Hi, I'm Dr. Peter Grinspoon, and I am a physician, a primary care physician who works at Mass General Hospital in Boston, and I teach medicine at Harvard Medical School. I'm a primary care doctor who, about 10 years ago, got into serious trouble with prescription opiates. I became head over heels addicted to Percocet and Vicodin, and I unfortunately was using my prescription pad to help me obtain these medications because, as we know, when one is addicted, your sort of sense of right and wrong and your judgment can be affected. So one day I was surprised in my office by the state police and the DEA visiting me with 3 felony counts of fraudulently prescribing a controlled substance. This led to the loss of my medical license. I had to take 3.5 years off work. I went to rehab for 90 days, and I was on supervised probation because of the felony criminal charges for 2 years. Since then, I've worked very hard at my recovery from opiate addiction, and I'm currently sober for 9 years, and I've been back at work as a primary care doctor for 8 years. I also worked for 2 years at the Physician Health Services, working with other physicians who are addicted to drugs and alcohol. And through my experiences, both as a primary care physician, as a person who has suffered from a substance abuse disorder, and as someone who has treated others, both as a primary care doctor and for physicians for their substance use disorders, I'm very interested in helping change the current drug policies. I think that our current policy of prohibition is incredibly counterproductive. If you look at the history of prohibition and making drugs illegal in this country, there's been no success in lowering the rate of addiction. The only thing that we've accomplished by making drugs illegal is that we've transferred a multi-billion-dollar industry out of the hands of the government and the healthcare providers into the hands of criminals and cartels. Millions of people are rotting away from prison, and it's a very, in my opinion, inhumane response to the disease of addiction to be punishing, criminalizing, and incarcerating drug addicts when, as I know from my personal experience being an addict, it is a disease. It's very difficult to get over, but it's not necessarily a death sentence. There is help available. One of the main challenges in helping people who are suffering from substance use disorders is the guilt and the shame that's associated with these disorders, and the stigma that we create by criminalizing addiction makes it much more difficult to have people enter into treatment. They're embarrassed, they're guilty, and they're ashamed. And ironically, making the drugs illegal and keeping them illegal makes the whole process of using drugs much more dangerous because people are afraid to call the police when there's an overdose. Luckily, now in some places, there are Good Samaritan laws where people don't get in trouble if they call for an overdose. The drugs are adulterated. We don't really know what's in them. Young people at festivals take drugs and it's not even the drug they think and they end up in the hospital. It would be much safer for everybody, especially the drug users, but also it will be much better for the doctors and for the government and the administrators if drugs were legal so they could be controlled, they could be regulated, they could be monitored. If people get in trouble, instead of wasting billions of dollars on criminalizing, prosecuting, arresting people for using drugs, we spent this money on treatment. Look, for example, at Portugal. Portugal had a horrendous problem with heroin and with all the other drugs that we are struggling with. And what they decided to do, instead of throwing more and more people in prison like we do, they legalized their drugs. Not only did they legalize their drugs, but they also dedicated the money and the resources that they spent arresting people and putting them in jail and tracking them and controlling them. And what you've seen in Portugal is that not only have the rates of addiction plummeted, they still have addiction. All societies have had addiction and will have addiction, but they have less addiction than we do because they've legalized their drugs and they're not wasting all of their resources on criminalizing it. And as a side effect, they have far fewer cases of HIV and hepatitis C, they have a vastly lower overdose rate than we do because, again, the medical community is involved and all of society is supportive of addiction as opposed to people being afraid of getting arrested and put into jail. Literally dozens of people every day are dying, and many, many more people are overdosing and suffering irreparable harm from their untreated addiction to heroin and other prescription opiates. They shouldn't be afraid of getting in trouble when they're trying to get treatment for a medical problem. One thing that many people are talking about in Boston, which I'm firmly in support of, is supervised injection facilities, which are places where heroin addicts can go and they can go either to inject the drug, or in some plans they can go after they've injected the drug to safely be there, and they're monitored by healthcare professionals who have Narcan, and which reverses heroin overdose, and they also have medical equipment to revive people. People thought if you gave people needles, that's going to encourage them to use heroin, but it's been studied, and people who are addicted will use heroin no matter what. It doesn't lessen or increase their addiction to give them clean needles. The only thing it does is it lessens the rate of hepatitis C and HIV. By the same thinking, these safe injection sites wouldn't encourage heroin use. They wouldn't increase the rate of drug abuse. And in the other countries, such as Canada, where they have safe injection facilities, this hasn't been seen at all. What we'd accomplish with safe injection facilities is that very few people would die from overdoses. Addicts are addicted and they need help and they need treatment, but you're not going to discourage them from using the drugs by putting them in prison. You're not going to discourage them from using the drugs by letting them overdose and die in the street. I think the humane solution to the fact that we're having this epidemic of opiate overdoses is to have safe injection rooms. And when you get them in and you have an audience with them and you have some connection with them, and that's a real opportunity to get them interested in treatment. If you're not judging them and criticizing them and arresting them, but you're sort of working with them and keeping them safe and healthy, it certainly is an opportunity to invite people to start taking treatment seriously. So I think that in addition to preventing overdoses, using these safe injection sites can actually give us a door into helping people get over the current opiate addictions.